health issue, and it is not talked about enough. What is the cancer moonshot? And in relation, of course, to cervical health that we're talking about, but also broadly, what is the cancer moonshot? And two, how can the cancer moonshot goals be extended to communities like these that are struggling with capacity to eliminate, toward the elimination of cervical cancer?
Yeah. The cancer moonshot was started by President Obama in 2000, when he was president, and then he actually asked, President Biden to lead that initiative, who became the Biden Cancer Moonshot. That was the first one, 2016. That was the last law he signed before leaving office. And then when President Biden became president in 2022, he reignited the Cancer Moonshot in 2022. With really two clear goals. Number one is to reduce the death rates by 50% in 25 years. And then number two is to increase and improve the experience of those living and surviving from cancer. Now, to your question about cervical cancer, I think what the engagement with the White House has really been, and that's something they're championing right now, is been cervical cancer. We actually know how to eliminate it. So we don't only have to reduce the death rates by 50%, we can just eliminate it. So this is something that we know how to do. What a great place to kind of invest, right, and collaborate around eliminating cervical cancer. That will really be a big milestone. And so the advocacy work around extending the cancer moonshot globally, because initially it was designed for the United States, but now obviously the White House is really engaging into extending this globally. As an example, when President Biden hosted African leaders in 2022, December, in the Washington, D.C., there was a clear highlight of commitments over $300 million from the United States to extend the cancer moonshot globally to Africa. And I know they are working to do more in that area. So I think the key areas to focus, you mentioned one, is workforce, right? So workforce that you've been talking to, we can make all the investments, bring all the drugs and treatments, but if you don't have the healthcare workforce to be able to implement that, you may as well not do that. Or the other one goes to not. And so I'm actually part of the leading team for the Cancer Moonshot Commission, which is really focused on focusing on building capacity in sub-Saharan Africa around, cancer, and therefore cervical cancer workforce development is really, really critical. And actually looking at the innovative ways where even if you don't have a doctor with specialized, you can have a community-based worker who is partially trained and focus targeting just cervical cancer. And so that's a big area, I think, that can help, accelerate, the screening and the vaccination and the treatment.